Hello, I'm Dr. Sunil. I would like to explain why the child health monitoring is so important. So the child health is very sensitive. Their immune system is not at all fully developed. So it is under development process. So the lot of viral, bacterial, fungal infections are very quickly, they can prone to get infection very quickly. So that is why. But if you wanted to understand the more deeply, so the nowadays in India, the 40% increase in the cases of child diabetes. So not even the adults, now the children are also affected with the diabetes as well. So over the period of time, diabetes increase your child risk of narrowing blood vessels, high blood pressures, as well as the heart disease and stroke in later in life. Also, the study conducted in 2022, the ICMR estimated the type 1 diabetic patient more than 95,000. So nowadays, the children, if they affected with the diabetes, in the future they possibly get the life-threatening condition as well. So the monitoring can help us to understand whether the child in future is probably convert as a diabetic patients or not. So we can start the prevention from the day one, like the children's having the high habits of taking chocolates, cakes, pastries, all the sugary items. So that we can control and prevent from the day one. As quickly as we can understand the children bad health impact the studies, because if children are going to become unhealthy, they take more sick leave, they become more fever, so they cannot focus on the studies at all. They will absent from the schools, colleges all the time. Overall, it will lead to the poor health. Also, the emotional health is going to be impacted a lot, because of once you become unhealthy, you cannot think in a positive direction. It will going to be hamper the way you are thinking. Your behavior is going to be get changed. Possibilities are very high, you will fall into the depression or any kind of mental illness. Obviously, when the family suffer a lot, once the child is getting unhealthy, the lot of financial burden initiate from the very beginning. So that is why this problem is very important. Now we wanted to talk about what is the underlying problem. Monitoring child is not at all easy. The parents are not at all going to be take the blood sample. It is painful, and even if you are visiting the doctor every single weeks or month, it become very expensive. But the monitoring is still very important. So we can eliminate these two problems with the child by monitoring. So what we are going to do, the IR health analytics, a painless deep monitoring system, we ensure the physical and mental well-being of the child. What we analyze, the physiological data, for example how the child's behave right now, whether they are feeling good or under depressed stressed condition, all the physiological changes which is related to any kind of diseases like diabetes, heart issues, any kind of skin fungal infection, their behavior data we analyze ki how they are behaving over the period of time. So for example, from January to December, how many times they are getting any kind of viral, bacterial, fungal infection. So we do the comparative deep studies according to the data we will receive, and that will generate an annual health report for the child, and it can help the parents also to take a very quick and very effective decision for. So this is how the school wellness health report looks like. You can see this is the male candidate, 12-year-old living in Delhi. So we analyze their dental, eye, skin, physiological data as well. And the behavior analysis we analyzed that found it out under the studies. So you can see the infection analysis, the viral infection 20 times, which is very high in that location, and bacterial infection as well. So we given that okay, that immune response is very low, so the parents have to look for their immune booster, so they can consult with the doctor according to. So this is how the deep data analytics, which can help in the further whether the child is having any kind of developing issues of diabetes, kidney issues, liver function, attack, and cancer as well. So now the parents will be also very happy once you are going to be implement this system in the schools. That can definitely going to be help it out. And even if it is going to be have like our health team is going to analyze entire data, they are completely consist of medical researcher, doctors, so that can add a lot more value to the institution. So IR believe The good health come from the good decision. So we want you to take a good decision with us. Thank you so. So now how the journey is going to be happen. Our team is going to visit your school. They will conduct a physical mode health camp. They will access that student health information. They will check their dental, eye, pediatrician. They will also understand skin infection. We try to understand. So all the parameters will going to be analyzed at your school. You will conduct the offline health camping according to as per the schools are going to give the date and time whichever it will be suitable for them. And on behalf of that, then our team is going to review the entire student health data and information, and we will give you that report. So this will help you to understand that overall health ecosystem in your school for overall health of a student as well as the individual health, and that definitely going to be add a value. So you can collaborate with us, with our team, and get on board. Thank you so much.